Aye. Hi, Andy. You're muted, I think. Unmute yourself.
Okay,
So who we got here? We got Claudia, we got Louise, we got Ed.
rename.
Hello.
Louise.
Yeah,
Ed, you're muted. Louise, you're not.
I thought that was what I was supposed to be.
No, you don't. That's good. I saw it.
Yeah. Oh.
I just muted at my end. It needs both ends working that way.
Oh, okay.
And Peter is so good, he's on twice, apparently. Well done. This is very good. I got the note from John that he's going to have his knee done and
Yeah.
all that stuff. He won't be here tonight, but he did send his agent's report, but he also sent a 4-line thing about the work to be done and what he can do and what he can't do. And he doesn't get any, paid time off for being sick. And so we'll go through it and discuss it. And we don't want him to be overdoing it.
Good.
Is
I'm
that-
glad everybody got the link. I sent it out this afternoon. I wanted to make
Yeah, I
sure.
know.
everybody-
Yeah, I
Yeah,
saw it.
I saw that. Yeah.
Yeah. I mean, knees are not easy to rehab compared to hips, where you get up and walk home. They're doing it drive-through these days. I think it's that good. But a knee is an unstable joint. There's nothing apart from the muscles and the little ligaments that keep it together. You put a bit of local anesthetic in your quads and you'll fall over. It's not good that way. Anyway, we're waiting for Fred. Danielle may or may not be here. Claudia, do you know?
I don't know.
Yeah, I mean,
I doubt it.
I understand, she can always look at it another time. That's no
Yeah.
problem. Yeah. Anyway, wait another 2 minutes and we'll start. Who's here? I had to get a Zoom password because for some reason it insisted that I had to open this up as host. And therefore I had to log on. Oh God. So I've got another password to remember. There aren't enough out there. Okay, where are we going? Here. Emily, yes. What the hell have you been doing with yourself the last 4 weeks? Nothing, probably. I don't know.
I have no excuses. I cannot
know.
tell you.
What a
No
life.
excuses.
I mean, I heard you yesterday at Dan Doyle's phone in, just having fun all the time. Yeah.
Emily,
Yes,
is your office in the old West Stockbridge School?
yes, it's the West Stockbridge Town Hall.
Okay, let's start. I appreciate everybody getting together at this time, but I plead not guilty. For some reason, the computer sent my agenda to junk, which is fair enough. It's a good classification. I wouldn't argue that, but what can you do? So Claudia and Danielle were going crazy on Monday morning looking for it. I don't blame them. It's a bit much. Anyway, I think we sorted that out.
Did.
Good. And as nobody had anywhere to go except Emily, of course, who travels around the fever pits of the Berkshires. The minutes, did everybody get the corrected ones and see them?
Yes,
Yeah, okay. Do we have any other corrections, alterations, additions, or comments?
No,
Not from me.
not from me either.
no, or me.
Okay, that sounds good. So we will move on to the next business, which is the old business. I put on the
Well,
first thing.
you should make a motion to,
Oh, yeah, do we
accept
accept those minutes as read?
I,
Aye,
Good, one more, Louise, do you want to say?
Yeah, yeah,
Okay,
sure.
good. Okay, fair enough. Excellent,
Drifting.
yeah. I put down Balderdash first, although you don't know what they're doing. There was, Claudia, were you at, or do you know what the selectmen decided? Balderdash were putting in an amendment to their,
well, I listened to part of I listened to about a little over an hour of the meeting last night.
oh
And I
God,
mean, they weren't gonna actually vote on it last night. They're going to put up the new amended permit application type of thing online. You know, they wanted to talk about it, and in 2 weeks they were gonna vote on it. But
okay.
it got a little more involved than they thought it was gonna be.
Sounds like it.
Because
gather
instead of just having, they were rolling in both the wine tastings and the like the weddings into like one one permit permit, and it was getting, I think it got a little more complicated than they expected.
Well, it
And
sounds
so I think
ridiculous.
they weren't they didn't vote for anything until, and I think they were gonna do it in 2 weeks. They said they weren't actually gonna vote on it last night. They were just bringing it up, and they were gonna have copies available for people to look at and make,
Right,
know, comments on.
right. It strikes me it would be ridiculous to make any permit permanent with the changing environment of COVID. I mean, how
Yeah.
many people are you going to allow permanently? 6, 60, 600, you know?
Mm.
They want to do
They
a
talked
wedding?
about inside 100, and then if it was going to be over 100, then they were going to have to get a 1-day special permit, like for if it was going to be like a wedding for 200 people, they would have to get a special permit, a 1-day special function permit.
Is this
But
assuming,
they didn't make any final decision.
but does that assume there's no COVID around?
I think, well, they're talking about this is for like next summer and after that.
Oh, okay, okay.
They're not talking about this winter or spring.
Oh,
Okay,
okay.
okay.
I was
Talking
getting
about-
very worried too.
They're talking about it for like next summer.
Okay,
And
okay. So we'll
um,
see what they say.
well, Claudia, I would hope that they would hold off the final decision until next summer, because we don't know where COVID is gonna be next summer.
well, I think it's all based on what the rules are anyways. If the rules say you can't have more than 25 people, then no matter what the permit says,
Right,
it's meaningless.
Right,
Okay.
yes,
So I don't
Okay.
think that really matters, because I
yes,
mean, restaurants can have, say 150 people, but if the governor says you can only have 25% of that, then that's all they can have.
yeah.
Claudia, are
Um,
they asking for comments from the general public?
They were, I mean, that's kind of why I stopped listening after a little over an hour, because there was a lot of people talking, people for Boulder Dash and people against Boulder Dash. The big thing they were talking about is, I mean, what Christian Hansen wanted to amend the original permit, because the original permit didn't take into account the barn. And so they were they're planning on redoing the barn, assuming they can have, be permitted for having functions in the barn. I mean, that was what one of the things was all about, that he applied to have the permit adjusted to allow, for the barn.
Yeah.
So
So,
that
I mean,
their big things would be in the barn.
So is these stuff going to be published someplace for us to look at, or?
They were talking about publishing it, having it on a link on the website. I'm not sure, there was some disagreement between the selectmen last night about it. So I don't know that it's going to be a finalized piece of paper yet to actually put on the website until they talk about it again.
it
Like I said, I
strikes
didn't
me,
I didn't stay on for the whole thing. After about an hour and a half, I gave up.
you're a very brave woman to do that long anyway. It strikes me that you know, if we get back to normality with a wide distribution of the vaccine, it turns out to be effective, and the few people who don't want to take it don't wander around, or they can breathe on each other, then the Board of Health will have no particular input because we won't be talking about a health problem.
Yeah.
We'll just be talking about fitting number of people into an eating place, which is not normally under our purview. So let's wait and see what happens.
But Tony, if in fact there are people who do not want to get vaccinated, they're possible carriers. Aren't we in a position to step in or say something? Or
I don't know. I mean, I don't know what we can do with that. There's no mandatory vaccination and we can't permanently quarantine them. But the theory is if you've got a vaccine, that's why you've got a vaccine. It will protect you against the disease.
yeah, but we know that, you know, people believe the vaccine, you know, invites aliens into your head or.
Well, I understand that, but
Yeah, but if they come in and can infect and possibly affect some other people, what?
But how do you keep them out, Peter? I
Yeah,
mean,
That's
unless you
what they're
have,
vaccinated.
unless you have a card that you require people to show that says, I have been vaccinated, okay, you can go in. You don't have that card, you can't come in.
I like that idea.
maybe we could put sort of colored icons on people's.
No, just a tattoo on their arm. Give them a number on their arm.
I'm sure the members of the American Nazi Party can tell us how we can label people. I
think
just
the
don't
number
see
on the
that
arm
this
would be
is
perfect.
they said it
practical.
was about 70 to 80% of the people. If 70 or 80% of the people are vaccinated, then that would be enough for herd
Then we're
immunity.
okay, we're okay.
Yeah, but those people will still be potentially carrying it around, but we're hoping it, but not they, will die out.
Yeah.
Yes, right.
So,
Okay.
Let's clean the
um,
gene pool.
Yes. One other thing about Boulder Dash, there had been, I think, after the last meeting or shortly around the time of the last meeting, and I think Emily and I had corresponded about this. There had been more complaints about Boulder Dash. There is a,
I was gonna say, I have to say, I was listening for a while last night, and you had as many people pro Boulder Dash as against. Actually, more people, I think, got online last night on the Zoom meeting who were like in favor, who spoke favorably about Boulder Dash.
well, I'm glad to hear that because I really would not like to see it closed down. It's a reasonable commercial addition to what
Yeah.
small
And you had a
taxes.
lot of people last night that were spoke favorably. You had the same few that were unfavorable and a whole lot more that
understand that,
came on
yeah,
last night and
yeah.
spoke
They're
favorably.
a subversive group of Boulder Dash destroyers, and they have no relationship to any other alcohol maker in our town, so we won't go into that. But what had happened was the complaints were that a couple of times there'd been over 100 cars parked at Boulder Dash, and it was obviously there could be no spacing there, and the argument was if you're only allowed so many people outside, how do you define outside? If you look at the field they have running down towards the railway line and the pond, that would be ludicrous to limit that to 25 people. If you could physically distance them, which they were doing, because each table was separate and they had chalk around it and you stayed in that place and they came to you with the food and the orders. You had no need to leave unless you went to the bathroom, and then you had to put your mask on and go that way. And I was thinking about this, and Mr. Hanson actually called me. Somebody gave out my name. That'll better not happen again. And we had a nice chat. And, you know, he said he thinks the best they could do for parking would be 65 to 70. He said there's no way they're going to get 100 people in, 100 cars in. And they've never had that many people there. But this was as the weather got cooler, and it was the weekend after Thanksgiving, was the first weekend after this came on, and they weren't doing anything organized. They were going to advertise if they were going to open up on a day-by-day basis. And as the weather was so cold, I didn't think there was anything, no point in getting into an argument that was just theoretical or moot, because there weren't going to be no big crowds there. So I just left it at that. And unless anybody thinks we have to go further now, I think we should wait and see what happens for the summer, really. I think our job is to make sure that the COVID regulations are followed, but we're not rushing to close them down, is my feeling. But I'm a little biased in their favor, I'll admit that. Okay, let's move on. I think the next thing I had down, Ed, do you have anything to tell us about the two houses?
Yes, I have updates on both.
Oh, wow, good.
I know, in both good news, by the way.
Oh, great.
282 Canaan Road was the initial one we discussed, whether to call Child Protective Services or not. And
Yeah.
we finally had one of the Alliance agents, Charlie Kinnicky, got in there. He actually got in there today with the owner and met with the tenants. And apparently the tenants have used the time from our initial contact till now to clean up the apartment. And Charlie basically went through it with them. The only issue he could find was there were some non-functioning smoke detectors. But as far as the big concern, whether there was, major sanitary code violations and the children being alone, he said none of that was an issue. It's been cleaned up, so that one should be put to bed and off the Board of Health's radar.
Okay, that's great. Thank you, and thank you to Charlie.
Yep.
And the other one, which is on the pond, is that right?
Yeah, that was 2 Willow Road,
Right.
and Charlie did that one as well, but that was last week. And it was almost the same scenario. He went there, met with the people, met with the owner, and there was no sanitary code violations that he found. I mean, a lot of times these housing issues are drawing complaints for other reasons, whatever they may be, but
Yeah.
it's our job to check them. He did. He sending me pictures and reports. I will forward all that to the board, but as of this time, there's no further action he's suggesting on either of those by the board.
Great. So we can strike off those two as topics for
Yeah.
A, for us to take action, and B, to discuss. Thank you very much. And would you say thank you to Charlie as well?
I will.
I have a
Appreciate
question
it.
for Ed.
That's good.
I have a question for Ed. No?
Yes.
What about the Bartlett's thing? I understand that got solved by itself.
Oh, yeah, thank you for reminding me. I forgot about that. After the board meeting, there was an issue of whether the letter that we sent regarding their training and the physical facility was done. I did speak to the manager, one of the Bartlett's, and he said he did take the training course and he's just waiting on the paperwork for the certification. And that they are working on the physical facility, and before the end of the year, which is the deadline he was given, I'm to go back there probably in the next week or so, get a copy of his certification just to make sure and to check on the physical facilities. But he's very cooperative, and I'll just verify that he did what he was supposed to do.
Okay.
Yeah, a question, what about Hilltop? I was wondering today, for some reason it came into my mind. I wondered what had happened there.
Yeah, Hilltop was one that we had talked about months ago, and there was, I wished I knew we were going to speak about that because I would have reread my file, but I wanted some direction from the board as to what should be done on that. Claudia, do you recall what
Well, they hadn't ever done anything. I mean, they had applied for a permit, but we never issued it because they had no serve safe. They didn't have a whole lot of the things they were supposed to have. And at one point they were closed because they were going to be sold and sell off. They started selling off their equipment. And then I guess they came back with more, and then they didn't, the sale fell through. And they tried, and they wanted a permit, but we didn't issue a permit because the person who had ServSafe wasn't on anybody there. And, you know,
Okay, I'm remembering more as you're talking. There was an issue that John Olander told me about with the septic system.
yeah, there was a lot of issues.
Yeah, it sounded like there were major issues. And a matter of fact, I talked to one of the Alliance health inspectors about going there, and she refuses to go there because apparently she went there. It didn't go well. So I think my thinking was I wanted to go back to you, the board, and ask you what you want me to do, because it sounds like there's significant issues here with the septic, their training, and their ability to do whatever they're trying to do. So I guess I need some direction on what you exactly want me to do.
Well, without some of the previous documentation, you have a file on this, you said, Ed?
I have it somewhere, yeah, and I apologize. I should have followed up with that, but these other, I think
Oh, that's
Camp
okay. You
Richmond,
want
yeah, Camp Richmond came
understand.
up, and we did that, and we've done these others. So now is probably a good time, because I think, Claudia, you know if they have a permit now that's expiring at the end of
Well,
December?
they were never issued a permit for 2020 because I had spoken to them multiple times about, you know, making sure they got in their, you know, their paperwork into, you know, their ServSafe and all their other paperwork. And before we issued a permit, I actually never did issue a permit as far as I remember.
Yeah, and I also think there was letters from the board prior to me that were sent to them that they just ignored. So I guess I would suggest getting a list together what the issues are, what we think the issues are. I'll have to talk to John. To me, one of the bigger ones sounded like this failure of a septic system years ago. I mean, that should shut them down immediately. So I really don't know what happened. And it sounds like there's so many issues with this
Well, have
place.
they reopened? At one point, like I said, at one point they were totally closed because they were supposed to be sold.
Well,
Have
trying to
have they
sell,
reopened?
I don't know, but they're trying to sell that. It's not been sold.
No, it was the sale that had actually, they had a agreement and that fell through.
Well, I suggest, is there an emergency or anything we have to act on right now, or can we wait till the next meeting and review? We can look at our minutes, and then we can also, Ed can look through his file and we can discuss it the next meeting.
Yeah,
Or
I
does it-
suggest that we put it on the agenda for the next meeting, and Ed, if you can look through your files. I
Yes,
recall, as Claudia did, that there were multiple issues there,
Yeah.
minor ones and major ones, and that we never really dealt with them.
Right,
There was a lot with the people that they had hired.
Yeah,
And,
exactly. And they were living in a trailer or something.
right, yeah.
next to
And
it,
there was problems
they
with
were
having a
using
bathroom for them.
The toilet facilities within the space, I don't know, it was very
It was a
complicated.
mess. Yeah.
okay.
yeah, all right. We can use the time between now and the next meeting to do our research, and then I'll have hopefully a
Right.
better idea of what the issues
enough.
are to look at.
Yes, okay. I noticed that Chris Hansen is here online from Balderdash, and I'd just like to ask him, I don't know how much you were present and listened to what we said. Is there anything you want to add, Mr. Hansen?
I apologize. I was trying to track down the passcode to get into the meeting. So I had to call John Olander, who finally, his wife found it, in fact. So if you did talk about Balderdash, I apologize. I missed everything. But I'd
Okay,
be happy to comment on anything if you need any input from me.
okay, let me tell you roughly what we said. Claudia told us about the meeting, which probably explains why you were a little late today, because it went on so long.
I was only on for
Yesterday,
about, I
with
didn't
the
stay on for the
director.
whole thing. I was on for about an hour and a half of the meeting.
Yeah, and that was only the minutes, I understand. And thinking that there's so much flux on rules of COVID at the moment, and whether, you know, a good vaccination program and ability and supplies are available, this may open up. And, you know, what you were discussing of having your permit changed for larger gatherings, that really depends upon COVID, obviously. because any COVID restrictions would supervene on your permit. The Board of Health is just sort of sitting and waiting to see what develops, and if there's anything we can do at the moment, we will do, but we're just sort of watching and waiting.
Okay,
Okay?
great. Yeah, I just wanted to make sure it wasn't an issue or anything you wanted some
No,
input
no,
on.
no, it's.
So my question, Mr. Hanson, do you have activities there during the winter? Or is it mainly during the summer?
We normally have activity throughout the year when we don't have COVID. So at this point, we're kind of taking things on a week-to-week basis. And if things look nice, we may do something outside for one day. But I am concerned about doing things inside, which, as far as I understand, we're fully permitted to do at a significantly reduced capacity.
Right.
But we're not really even comfortable doing that at this point. So we're taking it week to week. And if we can get something in the high 40s, we're going to have something outside. If not, we're going to stay closed until at least the spike in the county really, spike of cases in the county goes down. It's just not something I want to get into.
Yeah, it's not a good time.
Nope.
But we'll pray for global warming so you can open up a little more during the winter.
I think everybody else wants snow. That's so more people make their living, unfortunately, by ski areas right now.
No satisfying everybody. Right. Okay. Emily, we've had some random cases in Richmond.
Yes, yes. I've been busy. So if I seem tired, it's because it's been a very, very busy
I
week,
can imagine.
actually.
Yeah.
The last week's been very, very busy. In terms of the Berkshire County numbers, if you read the Berkshire Eagle, there's a section called the Checkup, and they give a really nice presentation of what's happening in Berkshire County, the cases, what's going on in the nursing homes, which is very tragic, as well as statewide. So I would just encourage all of you to review those numbers on a daily basis. He has a lot of good facts there, and they do a good job. The state reports for the town usually come out every Thursday, every weekly Thursday, and that's when you get to see how the town's numbers are coming up. And also the color-coded designations are also put out at that time too, in terms of high risk and moderate risk, and all those kinds of categories are all pretty well mapped out too. So for Richmond, over the past week, I've had 4 positive cases and 1 probable case. So just to explain that the state only reports in the town by town data, only the confirmed cases. So just to say the confirmed cases are reported, you'll see those probably tonight. But the probable cases, no, those probable cases come up when someone is tested with the antigen test, which is the rapid test. So they fall under the category of probable, but we treat them as positive because they are positive. So we have, like I said, 4 confirmed cases and 1 probable case in Richmond. And in terms of how the infection is spreading, most of these right now are through household members. There's no involvement with the Richmond school or the other school that's on Swamp Road. The school is open. Everything's going well there, given everything that's going on in the community. I'm always happy that that school is open every day that it's open. So that's good news. But you can see that the cases are just exploding all around us. And let's see what else I want to share about that. In terms of the testing, on the call with Dr. Doyle yesterday, I'll briefly mention that the contact tracing that I do is going on, but the test results are taking 5 days to come back, which doesn't really help us very much at all when you have such a time period, and it's ridiculous. So I believe as of next week, the platform is going to change using the Broad Institute, which has a quicker turnaround time than Quest Lab. So hopefully that will start that next week. There's also going to be a lot of other testing facilities that are going to be using the Broad Institute. I believe North Adams, Fairview, and Pittsfield. So we're hoping, we have to improve the testing. That's really the only way we're going to get a handle on it. So I'm happy about that. And what else?
Do you have any comment on the CDC's new guidelines for
Right.
quarantine? And
Yeah, I think
does does that have to be accepted state by state or?
Yeah, I can't speak for every state, but I know with Massachusetts, we follow the Massachusetts Department of Public Health guidelines, which bases their guidelines on the CDC.
Right.
Right now, Massachusetts went ahead and had changed the quarantine regulations from 14 days to, if you get a negative test on day 8 and you're asymptomatic, you can leave quarantine by day 10, exit on day 11. That's what the regulations are right now. But the CDC had come out yesterday and suggested that they're going to shorten the actual full quarantine timeline to 7 days. So when they wrote up, it's sort of layman's term language, the way they wrote it up, like after 7 days and you get a test. It's like, well, do you get a test on day 7? So we have a lot of more specific questions that we have. I don't believe it's a formal guideline right now. I know it's being talked about. And in terms of Massachusetts Department of Public Health, I haven't heard anything about it being formalized as of yet, but I'm sure they're going to be doing something.
Okay. Now, I have a question to ask you. I was talking to my younger son today. He's a health management executive and he's been following this. He's saying the CDC has been aware and have been wanting to promulgate these new guidelines for quite a few months. Is that correct, as far as you know?
Yeah, I mean, there have been studies, they've been studying to see how long most people would be infectious for, or how quickly people are infected after they're exposed. So they've been watching all along, and I mean, there's just a lot of pressure to, do we really need to quarantine for 14 days? And so all of that's up in the air, and how much compliance do you actually have with 14 days? Would you get better compliance with a shorter quarantine period? So all of that, yeah, so that the data is all there. And I imagine that's why they made their decision.
Okay.
In that way.
Emily, I was told that if you leave the state and come back, just, go to New York. And when you come back, you have to quarantine yourself. Is that
Or
still-
get a that's correct. Yeah. So the only state you can go to, I think, is Hawaii.
Oh, my.
Good.
So we can all go to, I'd love to go to Hawaii. Right, but that's
Right.
correct. If you leave the state for any reason, you have to provide a negative PCR test to get out of a 14-day quarantine in Massachusetts. If you go to mass.gov, there's a travel advisory there, and all that information is spelled out very clearly.
Well, how does anybody check it? I mean, I plan to go visit in Westchester this weekend and come back. I mean, who's going to
Yeah.
watch?
Go to New Lebanon and nobody would ever know.
Well, yeah, just to say, just because of how bad this outbreak is right now, it makes sense to be very, very careful and very aware of the cases that are coming up. So if you do travel to Westchester, yeah, you have to get a test before you come back to Massachusetts, or quarantine and get a test while you're here. Yeah.
Somebody said CVS is giving tests. Is that true?
Yeah, they are. Yes, and MedExpress, CVS, that's correct. Yeah, but that's true. You travel anywhere now, you have to come back with a negative test. And I've had people, believe me, a lot of my cases, especially over the summer, were travel related, where they did not read the guidelines and they thought, I'm just visiting my family. And we have this magical feeling about our family members, like, oh, they won't give me COVID. And they come back and they're positive and they spread it to their families and their workplaces. But I mean, the guidelines are there really to protect everybody, and including yourself. So that I'm all about the guidelines, the travel guidelines, believe me. I've had so many unnecessary cases because people didn't read them.
Okay, thank you, Emily, which gives us a good segue into a new business. And tell us a little bit about the possibility of vaccine, where, when, how, and I'm sure you're enjoying playing with your -90-degree refrigerator. Too easy to.
Well, I just want to, can the board give me, $1 million so I can buy that refrigerator?
Peter,
Freezer, I'm sorry, the freezer. I don't really have any information now about a vaccine. I know that plans are in the works right now. I just filled out a form with the Department of Public Health in terms of getting my enrollment ready for the vaccine when it does come out. But it's all in the planning stages. The funding hasn't been sorted, so I don't have anything else to add to that right now. But I do know, I mean, just reading the news, just like all of you, that it will be, there's going to be a phase period where, say, phase one, it's going to be medical people, medical responders who work with COVID patients, emergency response. There's going to be a whole way that they're going to be organizing who gets it. But I do understand also it's going to be an all hands on deck situation where not only public health will be giving it, but I believe the pharmacies are going to be on board, the hospitals are going to be on board. Yeah, but when I know more, I'll definitely bring it up to all of you.
I would assume the boards of health will be priority for the vaccine because being frontline workers and dealing with the most sick people,
Yeah,
like Peter. Oh, not mentally, I'm sorry. Yeah. Okay, we'll wait on that one. That also brings me to the thing that Laura sent out. There is emergency money for any expenses we have incurred or Emily has incurred, I would imagine.
Yeah, no, I mean, I read that too, and it's, I don't need any funding at all.
Okay.
So
I
I
don't
think
think-
Laura, yeah, Laura was
I don't
wanting to
think
get
there's
an answer.
anything
as soon
that
as-
we have done that way at all, unless we can take some for the when the Board of Health dinner's open and we can get to the bar properly and have a good, fun
So,
there. Yeah, I looked at it and I didn't see anything that we could apply for.
Yeah, so Laura was just asking you if you could respond tonight or tomorrow.
Right. Yeah, no, so
Are you
we
gonna
won't.
want us to like help with, when I, a few years ago, when they were doing the H1N1, shots, and they had the big clinics. The board, when I was in the Board of Health in Great Barrington, we helped with, the set doing the clinics. Are you gonna want us to help with that?
It really, I'll let you know. I don't have any details about how these clinics are even going to work, especially if the vaccine has to be frozen.
Mm.
That requires a lot. So when I have more details, I'll let you know.
Okay. You may have got in the last couple of hours, oh no, it was sent out. John's report was 11 o'clock this morning, but he put in a little letter. If you don't have it with you, shall I read it out now?
Please, yes, do.
Okay, it goes, I am tentatively scheduled for knee replacement surgery in late December, so I will be out for a while after that. Since I am part-time and have no sick leave, I propose to be taken off the payroll starting, say, January 1, and that the town pay Claudia to fill in. I've asked her about this. I'll be happy to assist Claudia with anything she needs to know. Oh, Claudia, you know everything anyway.
Yeah, not quite. I don't know. Well, what I was thinking was, it would be for Ed to maybe come down one day a week or one day every other week and work with me in the office.
Okay, let me just finish what he's saying and then we can talk about it. There is a lot of office work, filing and finalizing project permits, which was put off during the busy summer to be completed. So maybe we can catch up on most of it with me working as a volunteer, even without doing the field work, inspections, witnessing, perk tests, etc. 4 hours a week is barely sufficient to cover the office work for the Richmond Board of Health, especially when you get older and slower. That's John's statement. So, Claudia, I'm sorry I interrupted you before.
No, I thought you were dying. I interrupted you. No, what I was thinking was maybe, I don't really, I can do some of the filing and things like that, but there's a very, it's getting confusing between what's going on at the Alliance and paperwork that's coming into the office. So I was thinking maybe Ed could come down like one day a week or one day every other week, and he and I could sit in the, go over some of the paperwork in the office and find out what, he has a better idea of what's going on at the main office with Rebecca and what comes in there, because some stuff comes into our office and then we have to tell them, and it's still, a lot of flux between what's in the different, what comes to the different places. Like the other day we got a residential food service permit request from Deer Leap Farm just up the road from me. Now, this is now, it's December, so is this, I didn't know if this was a, I asked Rebecca about, is this a permit, for this year? I mean, and then will they have to get another one in a month from now? Or, but I haven't actually heard back. I don't know if she's, so when checks come in, we deposit them, but then we say, who sent in a check and what it was for.
Yes.
So it's still a lot, very confusing. I don't know how to use the online, we haven't been trained on the online system.
Right. Now, you're saying that sometimes there's a lot of backwards and forwards and unnecessary time taken up and work, because some stuff belongs to Richmond and some stuff belongs to Pittsfield or the county.
Well, the Alliance does some things and we get some things, but there's no, like right now, I have no idea how to use the online system.
But no, before we get to that, is there any way of sorting that out before it, so that people will know where that stuff goes to?
Well, it should all go, we're trying to tell people to do the online system, but some people are just sending, printing out for, sending things in because they're used to John looking at their forms, and we're still getting a lot of the forms. So we have to then tell them to, if we get a Title V form, whether it's a failed or a pass, I then write to Rebecca, oh yeah, this just came in with, a failed Title V or a past Title V for this, wherever the location is, along with a check or not, if the check doesn't come in. And it gets, so we do the turnover of the money and then we file it away. But so I'm not, it's kind of still in flux as to where everything is.
I thought that the
Okay.
plan was everything would go to Rebecca. And
Yeah, I
then
know, but it doesn't.
it doesn't. Yeah.
It's a process. What Claudia is describing happened in every town, that people historically mailed things, paper, delivered checks, physically walked into the town hall and did things. So it's a process of converting them from that to the mindset of doing the online. But also what Claudia said about someone from the Alliance coming in there every week or every other week. That's what we do in other towns, and we can certainly do that.
Yeah, I mean, that's what Jane was doing.
Yeah, that makes perfect sense. What complicated Richmond was having John being so available that people didn't have to use the online, but that's gotten better in the last few weeks. We're getting more requests. I'm handling some jobs completely online, so it's getting better. We do need to set up with Claudia a time to come in every week, take care of the physical part. But what about where do we stand on the payments? Does Richmond do the online payments through Unibank, or what happened with that?
Well, we supposedly Rebecca got the information. I
Okay,
haven't,
good.
I'm not sure. I'm assuming people are being paid, paying. She was going to deal with that. If we get a check, I tell her what the check was and things like that.
Yeah, she's been on sick leave herself the last few weeks, so she's just getting back. So
That's why I was wondering, because I sent her a couple emails and I hadn't heard back.
yeah, we will. I will get with her and we'll get with you and we'll set up a time and weekly or every other week, because that's what we do with other towns.
That's what I was. Yeah, that's what
She'll get the physical stuff that you're getting, and then we'll continue with the converting of people to the online. And believe me, it is getting better from what I see. So it's
a learning.
getting there.
What you're saying is it's a learning curve and people are getting better at it.
And again, not to harp on it, but John was so available. They were to the point where they would call me and I would say, here's the online system, get on. And they would just bypass me because they knew they could call John and he would say, okay, and go do it. So
Right.
it was a little self-defeating, but he's gotten a lot better about saying no, and that has forced people to the online system.
I keep telling him he's got to just say no. He's got to say,
you
got to go through the Alliance.
He is starting to do that. So I'm seeing improvement, and we'll work with Claudia to get the the final people that, and there's always people in every town that don't want to do it, but we help them, and we'll make sure that they all ultimately will all do it.
Okay, thanks. Thank you, Ed. So do we, I don't think we need a motion to approve this particularly, do we?
No, it's, you're not making any, it's nothing,
No
it's not
change
like a
of
motion,
policy
no.
or anything? No. Okay, fine. You go ahead. That'd be great.
Tony, before you go on,
Yeah,
there's an issue that came up in the last couple of meetings that I don't think was ever resolved, and that was about the well testing because of the dump on Cone Hill Road, and
yeah, but
whatever happened with all that.
I know, basically, as far as I know, and I'm right, Claudia, the state has said they're not going to do anything about that till the restrictions on movement and groups
Yeah,
of.
Danielle's been working with the state. Danielle and Peter, they've been working with the state. They've done some of the cleanup, some of the major cleanup and things like that. They're getting rid of things, and I guess they have to. Because I was listening to one of the board meetings, and they have to get rid of tires, and there's a lot of stuff, and they are working on cleaning it up. Danielle did ask me the other day about the person whose house wasn't tested that this all started with. And supposedly he told Danielle that the Board of Health said that the Board of Health would pay for his testing. And I said, I didn't think that was the case.
No, I don't.
Because I thought that the last I remembered was you guys were talking about not, trying to get the town to do it, because if one person, because then other people got on who lived near there or within that same, within the 1,500 feet or whatever it was, whatever that time amount was, that they also wanted their places retested.
Yeah,
And
the people, but we didn't approve any money because we have no idea what the costs are.
Yeah, so I think you need to talk to Danielle about that, because Danielle was told by this house, homeowner, the person who initiated this whole thing, the one guy whose house hadn't ever been tested, that the board was going to pay for his testing. And I said, I didn't think that was the case.
No, we discussed it, but there were so many different prices suggested to us that the quotes were, and there weren't actual quotes from the people who were going to do it. There were estimates from John or from the last time, and we checked what it cost last time. But that's
So I think maybe you need to talk to Danielle and say that the board, never really said that they would pay for it, because that was the impression that she was given.
Okay. Yeah, I mean, I didn't have it on old business because my understanding was that we were just, or the state was just marking time till they can get a group.
This conversation I just had with Danielle the other day about the board paying for this one test, this one house being tested.
Okay. Cone Hill testing. Okay, I will email on that point. I suggest that we leave the discussion of the agent report for next time, because there's nobody we can ask here today about what went on and what these things meant and any great problems.
I would agree, Tony.
Okay?
I
Yep,
would agree.
me too.
Tony, I have a list of things the Alliance did, if you want me to run through those quick.
No.
Thank you, Ed. Yes, indeed. Do that. You can do that now.
Okay, we did Title V at 470 Dean Hill Road, which was a failure due to groundwater. We did a perk test on 1404 Lennox Road, which was a passing perk, 11 minutes an inch. We did a perk test, it's called Lot B on Swamp Road, which was a failure that would not perk. We did a perk test on 73 Rossiter Road, which was a passing perk at 8 minutes an inch. We did a perk test at 1181 Lennox Road, and I'm still waiting on the report for that one.
Well, that's Greg's house, isn't it? Oh, the late Greg. Yeah.
We did I issued permits to 2041 Swamp Road for tank replacement. Disposal Works construction permit for 1806 Dublin Road, also for a tank. And we issued the Disposal Works permit for 1404 Lennox Road. So that some of these jobs, we did the perk test through the online system, and then they're requesting the permits through the online system. So that shows that we are getting better. We're now getting, we're not getting half projects, half through the online and half through the office. We're starting to get more that all go through the online, which is how it should work. So that's why I was saying before that it's improving. I definitely see an improvement.
It's just a learning curve, and
Yep.
it's getting better. And as long as it helps you and John, if he's back or whoever, would replace him, it makes it much easier. And I think it makes it easier for Claudia and people at the town hall. That would be great. Was there anything else I wanted? I don't think anything special I wanted. Anybody got anything else that we could call new business or anything that was not put on the agenda? No. I think this is my last one in the chair. It breaks my heart, but I do want to thank particularly Peter for stepping aside and letting me take over at this most relaxing and quiet time for the Board of Health. All we
You're
need.
very welcome, Tony. It was my pleasure, really.
Thank you, thank you. I mean, the only thing we missed was like a fire in the town hall while we were sitting there having a meeting. That would have just really completed everything apart from, pandemics and anonymous phone calls about various nefarious activities of people trying to earn a living and things like that. So it is Fred next time. I hope he'll be able to log on because I just got an email that I just picked up now because I wasn't watching before, that he couldn't log on using the link that I sent him, considering I got on that way and you people got on that way. I don't know. I think it's his gasoline powered computer.
He should be able to get on with just audio on
Yeah.
on the phone
Yes.
as an alternative.
I don't know what happened, but I'm not sure whether we can do somebody can do a tutorial or what. It's
Yeah.
good. So our next meeting will be, sorry, here we go. December, no, let's have, will be the 5th,
January 5th.
January the 5th. I see nothing there. It's not the inauguration.
It's the vote in Georgia.
Oh, right.
I don't think that's the day I've been asked to testify in front of the Senate discussing possible fraud in Richmond.
Yeah, I was wondering about that. Are we going to have a recount or not?
No,
Recount, no, luckily Richmond was not picked as one of this, as a place for auditing for, the
good,
state,
because
state
I
drew-
told
the
everybody,
state drew lots
no, I told
for their
everybody,
check audits, and luckily Richmond didn't get pilled.
yeah, I told everybody it's fine because both Republicans were able to register their votes. So there was nothing to worry about.
No, I counted votes. I was very honest.
Good for you. I did. No, I mailed it in long time before.
I understand there were 200,000 votes flipped in Richmond.
Yes, yes, but only from dead people.
Maybe
Absolutely.
it was 20,000. I could have got the figure wrong, so.
Yeah, oh dear. Apparently there was a witness today, I think was in Michigan, who was so bad she even embarrassed Giuliani. which is interesting because she was his witness and it was amazing. One of her complaints was when she got to the polling center, she had to park her car and take the bus to the polling center. And this was obviously proof of some nefarious plot.
It is, it is.
Yes, indeed. Okay, guys.
Okay, thank you.
Oh,
Tony,
motion to adjourn.
for
I'm
your
sorry.
service for the last 6 months.
Oh, thank you, thank you.
Yeah,
Uh,
So
It
who- you have to,
may be
you
my-
you have to decide who's going to be the next chair.
It's Fred.
Fred.
Right.
Is that because he's not here to defend himself?
No, he
Exactly,
knows about
exactly.
it.
That's what we always do.
I already discussed it with him.
Oh, you did? Okay, all right.
He was absolutely underwhelmed, I can tell you.
Well, thank you,
Okay,
Tony, for your
thank you.
6 months service.
All right.
Okay, bye,
Bye.
everybody.
Bye-bye.
You have to make a motion to adjourn.
Oh, I have made that motion.
I
Now somebody
second it.
seconds it and then you all say, agree, you know.
I
Agreed.
second it.
Yay.
Thank you, Claudia.
Thank you.
Bye.
Hey, thank you.
Good
Bye-bye.
night.
Thank you, Ed. Emily, thank you, thank you, thank you.
Good night, everybody.
Good night. Where's my leave? No.